Good morning, guys. Tony Maritato here, licensed physical therapist, and it has been way too long since I've come on YouTube to answer your questions. So I'm going to read a couple questions from the Total Knee Replacement for Kind People Facebook group, and hopefully this will help you find answers that you're looking for. So Arlene in the group said, is a total knee replacement better to have done as an outpatient procedure or a hospital setting, and why? I'm 67 years old and will need my left knee done soon. I would tell you that most procedures, you want to do it wherever your surgeon is most comfortable doing it. That's the reality. You're picking the surgeon is going to pick everything else. But the idea is typically if there's a medical reason, if you're at risk for medical complexities or complications, you would want to have your knee replacement done in a hospital-based setting. Most people, though, otherwise who have been checked out by their cardiologist and approved for surgery are perfectly fine to have their surgery done in an outpatient or an ambulatory surgery center. You just want to be where your surgeon is the most comfortable. Another question that came in is, quote, anyone 3 weeks out still having a lot of pain and burning, it's so frustrating. 3 weeks is really early. I can tell you as a physical therapist who have treated hundreds of total knee replacements, 3 weeks is one of those inflection points. It seems like, the first couple days, people are pretty uncomfortable, pretty miserable. Then you kind of come into figuring out what's going on. By the 10-day mark, you make some improvement, you're starting to move a lot better. Once you get into that 3 week, it's kind of a no man's zone. It's like you're doing more therapy, you're moving around more. With that, you're getting more soreness, more pain, maybe more swelling. Once you cross the 4 or the 6 week mark, you kind of turn the corner again and you start to see a light at the end of the tunnel. So to describe your symptoms as pain and burning at 3 weeks, 100%, very common, totally normal. Obviously, if you think there's reason for concern, reach out to your orthopedic surgeon, your surgical team, or ask your physical therapist. But I would say what you're experiencing is well within the normal boundaries. Let's hit one more. I'm 8 weeks post-op. I've been going to the pool to do workouts, which I like while doing them, but they make my knee feel really stiff afterward, and it makes it hard to walk. So she's exercising the pool, 8 weeks post-op. Does anyone else do water exercises, and do they have this experience? I would tell you that experience is pretty common. Now, the hydrostatic pressure helps reduce some of the swelling. It helps press some of the swelling out of the lower extremity. The buoyancy in the water makes mobility a lot easier. But just like any exercise, I don't know how much you're doing. I don't know how intensely you're doing it. But if you're doing too much, if you're pushing the intensity or doing it too long, you will experience kind of that rebound effect of soreness. We have a saying, it's called delayed onset muscle soreness, DOMS, where anywhere between 8 to 24 to 48 hours after a workout, you're going to be more stiff. You're going to be more swollen. It's going to be harder to flex and extend and move around. I would say it's normal as long as that resolves. And if you want to experience less of that, you might look at reducing either the intensity or the duration of the workouts you're doing in the pool. So guys, those were 3 questions that came in within the Facebook group. You're more than welcome to join. It's a completely free community, open to anybody who has had a knee replacement or has questions about knee replacements. Otherwise, if you haven't already, please take a minute and subscribe to the YouTube channel. I really hope to cross 100,000 subscribers this year, and I can't do it if I don't have people who are willing to click and subscribe. It's totally free, no commitment, but I appreciate your support, and I'll see you on the next video.